So those of you who are in here already, I want you to take your drug book and I want you to find in the back row 7. Okay. Row 7. Yes, and we're going to learn how to use it. This is every year I get to this point and nobody knows how to use this book. So we're going to learn how to use it today because this is the best book on the planet. So find row 7.
Row 7 is where each is.
Well, I don't know. Probably out of the 16 weeks. So it's listed under ceftriaxone, right?
2, 3.
If you don't have your book with you, if you didn't see a note, look with somebody beside you. Ceftriaxone. Row 7. And everybody should have worksheets. Do we have enough?
It comes out the back.
The back row? Okay, then everybody take one that you took
Spin your whole
and pass them back to the back row. Just take 2. Pass one extra and let's pass it back. Keep 2, pass it back. So we'll see if we have enough for everybody to have 2. Okay, well, at least let's just start with at least having something in front of you. Then we'll go from there. Okay, let's talk about pediatric math. Basic pediatric math, and I'm sure this is probably what Mrs. Hyde's going to have on her test tomorrow, is converting. The biggest thing is converting pounds to kilograms. Okay? And we should know that by now, hopefully. Dividing and multiplying, right? And so we divide by 2.2. Remember, we would always like our weight to be in kilograms. Right? It makes us look a lot better. Have our weight in kilograms. So when you're talking about pediatric math problems, that's usually what you see. But we want you to understand where the pharmacy gets the calculation that they mix an IV piggyback for children with, okay? And that's what this whole worksheet is. Because if you are in pediatrics or in the emergency room or wherever, and you get a piggyback bag, it's already mixed for you. They've already done all this for you. But there's going to be some situations where you are, maybe it's the facility that you're in, maybe it's the shift you're on. I know when I first started teaching 15 years ago, which seems like a long time, but it wasn't a long time ago, Lake Norman had no pharmacy at night. So their nurses that work, still don't, so their nurses that work 3rd shift were responsible for all their medicines, mixing and doing everything. They didn't have that resource. So depending on where you go, you may be in a facility where you're responsible for doing this math. Why with children are we so anal? Because they're smaller, we have a smaller volume, a person, right? And 1/10 of a drop of a medication can make a huge difference. Okay? With adults, yes, it makes a big difference if we make a med error, definitely makes a big difference, but it's not quite as critical depending on the medication as it is with children. So you have to be very, very careful when you're doing those medication calculations. Okay, and you're going to see that in just a minute. It's quite a story. One of the things that I wish that, and every year I say this to Ms. Walker, I wish when you do your medication unit, I know she goes over your other drug book, but I don't think that you all went over this one much, did you? This book is the most wonderful book. And hopefully you're going to see that when we go through this today. This book is something that you should always have with you in your bag when you go to clinical. Because the Davis book is a great drug guide, but it doesn't have really good information on IV medications. And this is an IV drug book. This is all this is. So your IV pushes, your IV piggybacks, all of those medications, IV fluids are in here, and it gives you a wonderful breakdown of everything that you need for that IV medication. And I don't think that Davis does a really great job of IV stuff. They do a great job with kids, but they do not do a good job with IV stuff. So this should always be a reference. When you have an IV drug from here on out, push, piggyback, whatever, don't go to Davis, go to this, okay? And I'm going to teach you how to read it. All right. So the first thing you notice, did everybody find row 7? Okay. Now it does not matter. It should not matter much what edition you have. I'm using my 15 edition. Some of you may even have a 17 edition. Most of you probably have 16. Yeah. So this is the reason I use row 7 as an example is because it's fairly straightforward and it's the same in every book. So the first thing that you're going to notice is that it's not listed as row 7, right? It's listed as its generic, and that's ceftriaxone. So when you're having to tell your instructor what the medication is, you don't necessarily just need to say ceftriaxone, you need to say row 7. One of the things that I want you to drum into your head, and I hope that you've heard this before, is that when you're talking to your instructors and you're telling them about your medication, if you have an antibiotic, I do not want to hear you saying this is an antibiotic. I want to know what kind of antibiotic it is, okay? And this tells you under the word antibacterial, it says it is a cephalosporin, right? Cephalosporin. Do you remember your medication unit? You should have learned that there's a difference between broad spectrum antibiotics, narrow spectrum antibiotics. Remember that? Gram positives, antibiotics that take care of gram positives, gram negatives, combination. So a lot of times when you see your patients in the hospital, they're on multiple antibiotics, aren't they? A lot of times they're not on just one. They're on a couple of different ones. And the reason for that is because they work differently. Some of them may be bactericidal. So when I say bactericidal, what do I mean?
Kills the bacteria.
It actually kills the bacteria. When I say bacteriostatic, what does that mean?
Stops the growth.
Stops it in its tracks. So you may have somebody that's on a bacteriostatic antibiotic and a bactericidal antibiotic, and they're working together. Okay? If I say something is a broad spectrum antibiotic, what do I mean by that?
It treats
Kills a
positive
lot of
and
different
negative.
types of bacteria. So gram positives, gram negatives, a lot of different things. If I say it's a narrow spectrum antibiotic, what am I saying?
It treats a specific type of bacteria.
Pretty specific to the type of infection, the type of bacteria that we see. Flagyl is an example of a narrow spectrum antibiotic. It kills. It's typically used. It's sometimes used for skin, but typically it's used for gut. If somebody has C. diff, what do they put them on? Flagyl, because it's a specific antibiotic for that type of infection. All right. Row 7 is an antibiotic that is a broad spectrum antibiotic. It covers a lot of different things. And so after they do a culture, a blood culture, you will see, even before they know what the infection is, that them putting that patient on row 7 because it covers so much while they're waiting on the culture results. Okay? When the culture results come back, hopefully this is one of the ones that'll kill it. If not, then they'll switch it out to something else. But typically, this is one that kills a lot of different types of bacteria. All right. Now, let's look at all the different sections that you have in your book. The first section is usual dose. This is, under that section, that is for adults. That is for your adult patients. It breaks it down even not just adults, but like in my book, it breaks it down by meningitis, this is how much you give, gonorrhea, cha-cha-cha, this is what you give, perioperative, this is what you give. Do you see that? Mm-hmm. Lyme disease, this is what you give. So it even breaks it down even further on, is this the right amount and how much do you give for these specific infections? The next section is pediatrics, and we're going to look at that one in just a second. And then neonatal. Now, some medications are not safe for newborns, and it'll tell you in the book, it'll say, this is not indicated for children who are a newborn or under so many days, right? But it even breaks it down even further here. It says if they're less than 7 days old, this is how much they get. If they're 1 to 4 weeks, this is how much they get. Do you see how that does? Okay. The next thing it talks about is dose adjustments. And this is really important, especially with your adults in critical care. In adults, under dose adjustments, it says in adults with both hepatic and renal impairment. So what's that telling me? Kidney and liver. So people who have kidney and liver issues, the dose should not exceed 2 grams daily unless serum concentrations of ceftriaxone are monitored. Okay? So it gets really specific there for me. Okay? Dilution. Look how much information it gives you on how to dilute that drug. It doesn't give you that much information in Davis. It's very, very generic. So it gives you a lot, and we're going to look at that in just a second. Compatibility, okay? If your instructor says to you, is that drug compatible with what you've got hanging? Well, this book gives you a list. It goes on and on and on about compatibility, okay? The next section is rate of administration. Now, there is a difference in this book on intermittent IV and IV injection. Okay, is everybody hear what I'm saying? You're going to see some drugs that can be given both ways. This one can only be given intermittent IV. What that means is that is a secondary, that is a piggyback. That's what I'm going to hang. It's going to run for 15 minutes, and I'm going to take it down or leave it up or whatever. And then in 6 hours, I'm going to come and hang it again. If it said IV injection, what does that mean? Pushing, IV push. So make sure you're clear about that in your mind when it says IV injection and intermittent IV. Okay? Action. Hopefully you're still being asked what's the action of your drug. Now this action is telling me the action of a cephalosporin because that is what this is. So if I ask the student, I said, what kind of medication is this? I want to hear them say, this is a cephalosporin. And a cephalosporin, under action, says it's a broad-spectrum, third-generation cephalosporin antibiotic. It's bactericidal, we talked about that, to selected gram-negative, gram-positive, and anaerobic organisms. Okay? It tells you where it's excreted. If I'm on labor and delivery, it tells me that it crosses the placenta. If I am still in labor and delivery, it also tells me that it's secreted in breast milk. Okay. Contraindications is the next section. Precautions. Okay. Drug lab interactions and side effects. Look at all the side effects. Most of the time in Davis, what's the side effect of an antibacterial? Diarrhea, right? And that was always as GI upset or whatever. Look at all the side effects that listed here. It tells you every single thing that you can possibly think of. So this book is very, very detailed. Okay, very, very detailed, and that's a good thing because you want to know as much information about it as possible. The last section that it gives is antidote. Antidote. What do I do if I give this drug and they have a reaction? And it gives you in great detail exactly what you have to do. Okay. Some of these drugs are not easily fixed. Like with our narcotic, we give Narcan, right? That's the antidote. But some of these drugs have multi-system reactions, and so you actually have to treat each individual system. So it tells you you get this for this, you get this for this, you get this for this, and it gives you all the detail. What do you think about this? Do you see the value in all this information? See how wonderful this book could be? Yes. Yeah, it's a great book. You need to have it. You need to have it with you. Okay. So what we're going to do now is we're going to work through a problem on, this is a scenario that we are having to be the ones who mix our medication and put it in a piggyback for a child. And we want to make sure we don't have a pharmacy to help us. We're the ones having to do this. And we want to make sure that this situation is safe. So now this goes beyond us just having to calculate the weights to the pounds to kilograms. Okay, we're taking this a whole step further. The page that you have in front of you is one problem. That is one medication problem. That whole worksheet. So it is a long process, right? And it's going to take us a couple of different medications for you to understand how to do these problems. All right? All right, so the first thing I've done is I've given you a situation, and I want you to write this up at the very top of your worksheet. This is a 5-year-old child who weighs 60 pounds. They have some kind of soft tissue infection. Okay? The order is for a 750 milligrams IV every 12 hours. On hand, we have a 1 gram vial. Now we have to figure out how to make this drug safe for us to give it and how we're going to run it. Okay? So I've tried to make this worksheet as easy as possible for you. Step 1, we need to figure out proper dilution. So the first question is, what is your client's ordered dose? 750 milligrams IV every 12 hours. So in that blank, write that. 750 milligrams IV every 12 hours. Okay? Now, the next step is, what is the child's weight in kilograms?
27.
So we know that he weighs 60 pounds, right? So 60 divided by 2.2.
27.27 repeating.
Yeah, so we'll round up to the 10th, bless you. And let me just go ahead and tell everybody this up front. On pediatric problems, we're going to take it to the 10th. Okay? So we'll take it one place past the decimal. So 27.3. Now, again, let's go back and remember, do you understand why we're leaving it at the 10th and why we wouldn't go ahead and just round it up to a whole number? Because we're dealing with a child, aren't we? And remember what I said, a 10th of a medication can be detrimental. So for this, we are taking it to the 10th. We're not going to, of course, in this situation, we wouldn't round it up to a whole number anyway. But if it said 27.5, we're leaving it. Okay? Does everybody understand? Because it is that specific. All right. So write 27.3 in that little blank. Now, we've got to figure out if the dosage that the doctor ordered. You know, we all know this doctor might be an idiot. Who knows? They may be a resident, a first-year resident, and they ordered this, and they have no clue what they're doing. All right? So we've got to figure out, because we're going to be the one given the medication, not the resident. We're going to be the one given the medication. So we have to be the one that's responsible for making sure that this is a safe dose. Now, these are the steps that the pharmacy does that you don't realize they're doing, okay? But remember, we don't have a pharmacy. We're going to do this on our own. So is the dosage order the same dose? So let's look in our drug book, and it says under pediatrics, under soft tissue infections, okay? What does it say? 50 to 75 milligrams per kilogram of body weight in 24 hours as a single dose or in equally divided doses every 12 hours. Now, I don't care. You see in parentheses after that, it says 25 to 37 and a half. I don't care if you work this problem using those numbers or if you work the problem using 50 to 75 and then divide it by 2. I don't care what you do. Okay? We know that we're giving it twice, so we're not giving it as a single dose. We're giving it twice. So I'm going to work this out. I'm going to show you how to do it using 50 to 75. Okay? So the way that you do this, if the book says that I need 50 to 75 milligrams per kilogram, okay, every 24 hours. All right. I'm going to take 50 and I'm going to multiply it times my kilograms, 27.3, and I'm going to take 75 and I'm going to multiply it times 27.3. Okay? So tell me what you get for that. $13.65 is the first one.
2047.5 is this one.
Did everybody get that? Your little calculators? Okay. So now, this is in 24 hours. This is one single dose. You could do this a couple ways. You could then divide each number by 2, or what I would do is I would just take 750 and do what with it? That's it times 2. So what's 750 times 2? 1,500 milligrams. So I know that this child was ordered 1,500 milligrams in 24 hours. So is 1,500 milligrams in between 1365 and 2047?
Yes.
Yes. Okay, it's right in the middle. Did everybody see what I did? So yes, this drug is safe for me to give. Now again, that's a step that you don't normally see. That's a step that the pharmacist has to calculate. But we don't have a pharmacist. It's up to us. Okay. Now, when you have, because before the end of the semester, I want you to work one of these out on your own. Okay. I'm going to give you the next numbers where it says, after reconstitution, the liquid drug yields. You see that? Okay. Those numbers I will give you because it's not always clear in the book. But for row 7, it is clear. If you look under dilution, all right, let's back up for a second. Do you know the difference between dilution and reconstitution? Okay. So reconstitution, you have a vial of powder, you add liquid to it, and you make a liquid. I'm reconstituting something, right? Dilution means that I already have a liquid, and I'm adding more liquid to it to make it less thick or less concentrated. Does everybody understand the difference between the two? Okay. So this question says, after reconstitution, so I have my powdered vial, and I'm adding liquid to it. So if I look in my drug book, under the section that says dilution, it says initially reconstitute, there's that word, each 250 milligrams of sterile powder with 2.4 milliliters. And then in parentheses it said 500 with 4.8, 1 gram with 9.6. Everybody see that? Okay. So what size vial do we have? We have 1 gram. Okay. Now the next statement says each milliliter will contain 100 milligrams. You see that? So what that's telling me is that after I've added my 9.6 to my vial, okay, and I've shaken it up, it's going to make 100 milligrams per 1 milliliter. Now, do you remember when Ms. Walker was teaching you math, hopefully she made this statement, that it's magic. That, you know what, I don't know why it's not 100, but why it's not, it's, you add 9.6 instead of 10. It does, I know you want to do it that way, but it's however, it's somehow how they made that powder, it gives you, when you reconstitute it, it gives you more than what you think you should have. Does that make sense? It's just chemistry. It's magic. It doesn't matter. Don't try to figure it out, okay? Don't let it bother you. But in those blanks, I want you to put 100 to 1, okay? Because that's what it says it's going to be. And I will give you those numbers because other than row 7, some of them are not clear. So the next statement says, when mixing powder to form liquid, we just read this. How many milliliters of what do we use? 9.6. And then it gives us a variety of things that we can use. We can use normal saline, we can use sterile water, we can use, that SWFI, by the way, is sterile water for infusion. Okay? Do you know why it says that? If you look in an older book, if you have, Carrie has the 2011s that I gave you. Does it say just SW or does it say SWFI? Under dilution? Yeah. I'll tell you what happened somewhere. This is kind of scary. It says sterile water for infusion. Some nurse, somewhere, some fool, decided, oh, I can use sterile water to reconstitute this dilute, this powder, and went to their closet and got a bottle of sterile water that we would use for irrigation instead of a bottle of sterile water that we would use for injection. And those are two totally different things. So I understand that. So you cannot go get a 500 milliliter bottle of sterile water to reconstitute your medication. You have to get the sterile water in the little vials. You understand? No, they're just different concentrations. Right, not for injection. So that's why they had to change that in the book. So that's what SWFI means, sterile water for injection. Okay, but do you see that there's a ton of different things that you can use? So I don't care what you put in that blank. If you want to put normal saline, you can put SWFI. We know that we can use one of those things. All right.
And as an FYI, do not use saline flushes as your sterile water to reconstitute it.
And at Northeast now, they've got two separate things. They've got the vials, and they've got just regular flushes for IVs. You can't use those flushes for your dilute. That's what this guy's saying. And that's very important. Good thing. Okay. Now, after adding the above amount of dilute to the vial, how many milliliters will you withdraw from the vial? Now, I am a ratio proportion person because I'm old. Some of you, I know, are doing dose over half, just like Ms. Walker did it. If that's what you want to do, that's perfectly fine. If you want to do dimensional analysis, I don't care how you come up with this. Yeah, Ms. Beaver does dimensional analysis, which makes me confused. I don't care if you do that lattice thing that they're doing in math class. However you want to do it, just to get your number, as long as you get the right number. So I'm going to write up here the way I do it. So we're adding our solution to our powder to see how much we're going to withdraw from the vial. So I have 1,000 milligrams because I changed my 1 gram to 1,000 milligrams to make it simple, and 9.6 milliliters, and I want 750 milliliters. Those of you who do dose over half, well, it'll be 750 milligrams over 1,000
100.
times 9.6.
7.2.
Wouldn't it be easier to use what you got?
Which the 100 milligrams times 1 ml.
No, because remember what I said, you always are going to use what you put in there, because it's not always going to come out that way. So for kids, we've got to use 9.6, right? What it says. Because you're going to pull out 7.2 milliliters is how much you're going to have. And that 0.2 can make a big difference. So your answer is 7.2 milliliters. All right. So think about this in your mind. I've got a powdered vial. I've added 9.6 milliliters to my vial. I've shaken it up. Now, if you've ever looked at Rocephin without pulling it out, okay, it's very thick. That is too thick for me to do, so I'm going to have to further dilute it, and that's going to be our next step. So I pulled out of my vial. I don't need 9.6. If I pull 9.6 back out of my vial, that's going to give me 1,000 milligrams of medication. That's not what I need. I only need 750 milligrams. You see? And that's going to be 7.2 milliliters. Do not use that 100 to 1. Don't do it. Okay.
Well, I was going to say, why
You don't, other than the fact that it's in your book. It's not going to be a problem for anything. And if you want to make yourself a little note that says do not use anywhere, it's just knowledge. It's just knowledge for you. Okay? It's just knowledge. All right. It's because it's specific.
the reconstitution that you would normally use, like if you read for like an adult dose?
Yeah, because if you use that, it's 7.5 milliliters.
Does everybody
0.32
see?
much.
7.2 milliliters is your answer. Okay? Remember, this is not adults. This is children. If you use the 100 to 1 for adults, it wouldn't make that much of a difference. But for a child, it does make a big difference. So whatever it says you add, that's what you put. Okay? All right. So however you work it out, just say you get 7.2 milliliters. So I've got a syringe now with 7.2 milliliters in it. Right with me? I mixed it, I pulled it out, got 7.2. This is too concentrated though for me to give. The way I know that is because in my drug book it says a single dose must be further diluted to the desired concentration with the same solution and given as an intermittent infusion. You see that? So that drug book tells me that I can't leave it there. It's too much. It's too concentrated. All right? So now I've got to do something else with it. Okay, so it says, bless you, your drug book says to dilute the drug to a concentration of, and I just told you, 10 to 40 milligrams per 1 ml. So in that blank, there's 2 blanks there, the next 2 blanks, write 10 to 40, 10-40 per 1 ml. Okay? Now what this is telling me, or the pharmacist, whoever's mixing this up, is that I can dilute my drug either really, really, really dilute or just dilute enough to be safe. You see that? Okay? I tend to go with the higher number. I will give you that dilution range. Okay, there are 2 things that I will give you on this worksheet. The first one is that information that you don't really need. And this one I will also give you, that you're going to use this one in your next problem. Okay? So make a star or something to know. All right. So I use the upper number. So I want to know how much do I need total in order to make this drug safe for me to give. Okay? Total. That's what this is figuring out. So the way I work this out, again, ratio proportion, is 40 milligrams over 1 ml equals 750 milligrams over X. Now, those of you who do dose over half, 750 over 40 times 1. And you should get 18.8 milliliters. See that?
I just know
Did I get that?
How do you do yours?
The 10.
dimensional.
Let's do the 10.
Can't help you.
Now, I want everybody to try to picture this in your mind. Okay, I got two markers up here. So I've got, this is my original marker, or this is my original syringe, and in this syringe I have 7.2 milliliters of medication, okay, that I drew up after I reconstituted. But my drug book says, wait, you cannot give it like this because it's too thick, it's too concentrated, and for that child, it will damage their veins and their organs and whatever else. So I know that I've got to make it safe to give. Okay? My drug book says you have to add enough fluid to that 7.2 to make it safe. Okay? And I know that in my range, I need a maximum of 18.8 milliliters. Okay? So I have 7.2. I know that I need 18.8. So what do?
Get the 18.8 subtract what you already have.
Minus 7.2. Does that equal 11.6? Everybody get that? 11.6 milliliters. So I know that I need to add 11.6 more fluid to my 7.2 to make 18.8 to make it safe. Right? You're with me? Now, little children and newborns, we do not give drugs via piggyback in a bag. We don't do that because I don't know if you've ever noticed. How many of you have had the opportunity to hang a piggyback? Okay. Have you ever noticed that after it's all run, that 95% of the time there's a little bit of fluid left in the bag? After you've run, after you've set it the way it's said to and everything, there's still a little bit in there, and in the tubing, you notice that? Okay. For an adult, that's not a big deal. The amount that's in that tubing, that little bit that might be that you may see floating in the back, that's not a big deal. But for a child, that's a lot. Okay, you see that? So that's a lot of medication and fluid. So little children and newborns, we give medication through a syringe pump. Okay. And what that is, and you can use your regular pumps for it, but there are actual specific pumps, all syringe pumps. And what you do, did anybody get a chance to go to NICU in OB? We got some good Yes, you use them in the OR a lot, yeah. They're very specific. You literally stick that syringe on the pump, and it pulls the medication out of the syringe into the tubing. Okay? Again, you can use it on a regular pump. You just, instead of putting the tubing on the secondary, you just screw the syringe on there and it pulls it down. It's very specific so that they only are getting 18.8 milliliters. Okay? Do you see that? So that they're not getting too much or not enough. Because that little body is very, very specific. Okay? Does everybody understand? So we would take our syringe with 18.8 milliliters. We would screw it on our pump, put it on the syringe pump. Now we need to run it. Okay? So how many minutes, according to your drug book, you have to flip your page, it says rate of administration. How many minutes is this supposed to run over?
30 minutes.
30 minutes. Okay? Now, this is kind of simple, and a lot of people say, well, I can do this in my head. If you can do this in your head, that's fine. A lot of you can visualize the clock. If it said 15 minutes, you could think that's a fourth of whatever, or whatever. If I have to set my pump now to run 18 milliliters, so the first blank is 30 minutes, that's what our book said. The next thing says, how much total volume do you have? We have 18.8 milliliters. And I've even tried to put, like in parentheses, it says D, so you can go back to D and remember how much you put. What will you set the pump for? Because remember, pumps are milliliters per hour, right?
So 18.8 divided by,
So how do you do that?
18.8 divided by 1.
Divided by or times 0.5 or times 2, let it be. So 18.8 times 2, because I need to make an hour, right? And that's going to be 37.6 milliliters per hour.
Oh, yeah.
Yeah, you can divide it up.
That's what I said. She said no.
You can flip it. Okay? Now, what I want you to do is the next time you talk to your pharmacist, tell them thank you, right? Because 90% of the time, they're doing all this for you. And so when you get your piggyback or your syringe, it already has on there, they've already figured out the concentration, they've already figured out if it was safe, they've already done the dilution, reconstitution, and all that stuff. And all they've done now is just tell you how much they're in and how much they're running.
Did you round the last number?
No, leave it 37.6. And you can set those pumps for 37.6. Those pumps are very specific. Okay?
So when we have our, like, email, are you gonna give us this?
I'm gonna give you this worksheet.
And do we need to write, like, for the safe dose, because I'm used to doing, like, if it's 70 milligrams for 27 milligram weight, all you have to do is divide it to 630 kilograms.
If you can do it that way,
Okay,
that's
so
fine.
we don't have to put that.
I don't care how you get the answer, as long as you write. Does that make sense? Yeah. You can do it a number of ways. I'm just showing you basically. However you want to do it, as long as you get the right numbers. Do you see how important it is to get those really specific numbers and how crazy it is and how much we appreciate our pharmacists now? Right? All right. What I'm going to do is I'm going to give you another one to take home with you. Okay? And then I'm going to put the answers up on Blackboard. Okay? Just to practice.
But what's that? Is it on the
No, it's not going to this.
Yes, well, not partial. Basically, be prepared to do kilograms to pounds to kilograms. And be prepared to look at safe dose. Other than that, no. But you need to be prepared to do those two things
Okay?
So basically, if you want to do this first three
Do not
tomorrow.
bring your book.
Okay.
If for determining safe dose, I will give you the dose range that you need to worry about.
Okay? Alright, now listen. Everybody listen? So 2 things that you should have gotten from this so far today. One is that you should know how important that book is. That probably half of you just did plastic off last night when I put the message up that said bring your book to class tomorrow. Okay? And I want you to make sure, is everybody listening? Shh. I want you to make sure that you take that book to clinical with you from now on. Because when you have an IV drug, that's what I want you to be using instead of the other book. That's why we made you buy it, because it's important. Okay?
Things on the actual computer. Like the
So this is like in there now. It is, but
everybody gets this one.
as long as you have access to this book. This, you see the difference though between this and Davis? You see, I mean, it's a big difference. It's a big difference.
Basically done from PO.
It is. It's just PO stuff, so that's why it's not there. The other thing is I want to make sure that you have, everybody at least has a back to the sheet that I gave you, and hopefully some extra ones, right?
Yes.
Okay. All right, so I'm going to write a column up on my board, and it'll be one that you can take home with you, and I'll put the instructions up, okay?